This week on Inside Athletic Training, PBATS is launching a new educational program titled Tales of the Tape, in which we dive into the anatomy of America's favorite pastime with some of the brightest minds in athletic training and sports medicine. In this inaugural episode, we embark on a journey through the complexities of one of the most renowned procedures in sports medicine, Tommy John surgery, which celebrates its 50th anniversary this year, a procedure that changed the game forever when Dr. Frank Jobe performed the surgery in 1974. Hosted by Texas Rangers medical consultant Corey Tremble, this week's episode of Tales of the Tape, the Tommy John series, will dissect the ins and outs of this revolutionary surgery, exploring its history, advancements, and profound impact on the world of baseball. Joining us is none other than Dr. Chris Ahmad, iconic head team physician for the New York Yankees and Tommy John expert. Don't forget to tune in next week for the second installment of Tales of the Tape, the Tommy John series, where Dr. Ahmad will talk through details about the actual surgical procedure. Enjoy the show.
Well, welcome to Inside Athletic Training, and today we have a very special guest with us. We have Dr. Chris Ahmad, the head team physician for the New York Yankees. And he's going to be speaking to us about ulnar collateral ligament reconstruction, or more commonly known as Tommy John surgery, as we highlight the history, the advances, and the return to play from this. And, you know, it's become a much more growing piece to our game. And as a physician, author, and researcher, Dr. Ahmad's been on the front lines of this subject and has become a leader in the field. So our listeners better understand your relationship, Doc, with the procedure and where you've come from and how you've arrived to where you're at currently. Would you mind giving us a short bio of your journey?
Absolutely, Corey, and thank you so much for having me. And this is such an important topic. Let me tell you about myself. I grew up playing soccer. I actually didn't love baseball growing up. My brother was a baseball player, and I decided I wanted to do something different. But what happened is, in college, while I played college soccer, I was studying mechanical engineering. And I started working in Columbia University's orthopedic research lab, and we were breaking ligaments. We were breaking tissues and learning how they break and how we could better surgically fix them. And I decided I wanted to be a sports medicine physician and help the dreams stay alive in young athletes who may have been injured, especially with injured ligaments, and devote my career to getting them back on the field. So I went into medicine and sports medicine, fortunate enough to do a fellowship out in LA at Jobe, and where I made my dream, it's a little poetic, of becoming a sports medicine doctor at Columbia. I was fortunate enough to be asked to come back and work at Columbia. And during this time, I've been fascinated because of my engineering background and my interest in improving our understanding of how ligaments tear and how we can rebuild them better with the ulnar collateral ligament. And this has been a 21-year journey since I started as an attending back at Columbia, and really 30 years if you think that I started working as an 18-year-old college student on this problem.
Well, I'll tell you what, you talk about a full circle there. I don't think there's many surgeons or physicians that have quite that story. And especially, I know you mentioned your stop out in LA at Jobe, and I don't think we can just glance over that. That's quite an accomplishment. Obviously, it's one of the top tier, if not the best fellowship program in the country for orthopedic surgeons. And obviously, it was named after Dr. Curlin and Dr. Jobe, who plays a big role in what we're talking about today. So obviously, Dr. Jobe was the physician that did the first UCL reconstruction on Tommy John himself, and now it's 50 years old, back in 1974. Can you give the audience an idea of what that fellowship was like for you and that experience and how that's kind of molded you into the physician and surgeon you are today?
I would love to. Fellowship is a very unique experience in the journey of a sports medicine doctor. Medical school, you learn knowledge. Residency, you learn how to operate and you learn very technical skills. Fellowship, you learn what we refer to as soft skills. You learn how to develop relationships with athletes so that they trust you. You develop relationships within team organizations. One of the most important relationships a sports medicine doctor can have is with the athletic training staff. Just another reason why I'm so thrilled to be with you guys today. And there was no one who was better at it in my experience over so many years than Dr. Frank Jobe. My experience with that one-year fellowship in now LA, which was across the country for me, was spending a lot of time with Dr. Jobe and several of the other associates, Lou Yoakum included, and former team physician for the Los Angeles Angels before he passed away. And I spent time with him outside of the clinic in the operating room, but actually on the fields in spring training, seeing how he interacted with the players, the coaching staff, and also on game days at the stadium in Dodgertown. And so I have so many fond memories and just the appreciation of the respect that this man commanded when he walked around and how he interacted with everyone, whether it was someone who was in charge of cleaning up the dugout or someone who was in the front office. He gave them the same amount of time and respect. And as a person, he had such tremendous humility. He never wanted to take credit for the surgeries that he did. It could be called the Frank Jobe operation, and many operations are named after surgeons. Instead, it's named the Tommy John operation. And that groundbreaking operation that changed the landscape of baseball is not named for him, just another example of his humility. But it also does not express this man's surgical insight and his skill in conceiving of an operation and then doing over 1,000 of them in his career and really creating a pioneering foundation for me and many others that are in the world of taking care of baseball players.
You know, you mentioned Dr. Jobe in such an amazing light there, and obviously people like myself look at him as a legend in our profession and sports medicine in general, and you had the absolute joy of not only having him as a mentor, but as a friend and colleague as you progressed your practice. And it's amazing to know that obviously the surgery is 50 years old, but that these relationships with Dr. Jobe and his techniques and his surgery are still going strong today. But can you take us back? I know you're a bit of a history buff when it comes to Tommy John surgery and UCL reconstruction. Can you take us back 50 years ago and what that looked like? You know, I feel that athletic trainers, I could probably speak for a lot of us, that when we return a player from a hamstring or we return a player from an oblique, there's still that pit in our stomach every once in a while of, okay, is it the right time? Did we go too fast? Did we miss something? You know, this was about as sticking your neck out as it gets for a physician for what he did. So would you mind just kind of taking us through the information that you know and the stories that you heard about the initial Tommy John surgery?
Corey, love this history because it is fascinating. The first time I operated with Dr. Jobe and did a Tommy John, I sat on the other side of the arm that he was sitting on, and we were all prepped and draped and ready to go, and we exsanguinated the arm, got the blood out of it, inflated the tourniquet, and he looked at me and said, "I've done so many of these, I'm going to try this one lefty." And he grabbed the scalpel with his left hand, and he started slicing through the skin, and my jaw dropped. This is a professional athlete, and he's going to try it lefty. And the joke was Frank Jobe is left-handed. So he was, that's how he's always taking care of players when he's operating. He's a lefty, so he's a southpaw. I'm going to tell you about my knowledge of how Tommy John surgery came about, and it's because Frank Jobe, when I returned to New York, was a legend on the East Coast. And because of my relationship, we were having an academic alumni meeting. It's like a college alumni reunion, and we have all the residents come for academic education. And my boss, who hired me back, said, "Hey, what can you do to get Dr. Jobe to come visit and present to us?" So when I asked Dr. Jobe to come, he, of course, said yes. Days before the meeting, he had an issue with his back and he wasn't able to travel. And rather than just cancel, leave us empty-handed, he called Tommy John himself and asked him if he'd be willing to come in his place. So I got on a call with Tommy John. He said, "Tell me what time you need me." And Tommy John came to the meeting, and he spoke for about 30 to 40 minutes, and he explained his road to getting the injury and to the surgery and to all the fascinating kind of inside little tidbits. And so what a cool thing to have Tommy John come and speak to all the alumni at Columbia University. And the way he told it to me and to the way he expresses it is, leading up to this injury, he was having some issues with his elbow. He had a whole bunch of cortisone injections in his elbow, which was pretty common at that time. But one day, pitching against the Expos, he sailed one high and way out of the zone, and he felt like something was wrong with his arm, and he tried another pitch, and he felt like his arm was ripping off the socket. And so he walked off the mound, and he saw Dr. Job, and Dr. Job evaluated him and made the diagnosis. And 1974, there was no MRI scan. So the diagnosis was made by stress view X-ray. That is, Dr. Job and his team, one of his fellows, went in, put his elbow underneath the X-ray machine and put stress on it, and it showed that his elbow was gapping open completely. And just to give you a sense of, well, why are we talking about that besides the interest stake? No, it's interesting because there was no MRI. If you can believe it now, in, say, 2024, we now do MRIs with that kind of stress view technique. We call it the fever view now. And it gives more information when you have a player's elbow under some stress to see how the ligament's behaving. So when Job made the diagnosis, he put him in a cast and he gave him some time to heal and then tried to get him back with a strengthening and a progressive throwing program. It wasn't working. He was having pain. And at that time, if you were failing to get back because of a injury, just couldn't recover from it, they said you'd be sent back to the farm. And not the farm like farm leagues where you go to the minor leagues, the farm like you go work with your hands and physical labor on a farm. And John was a very, call it gritty person, and he was willing to take risks. And he said, "I need you to take care of me and fix it." Job said, "There's no operation to fix it." And he said, "Make something up." And in an amazing way, as the legend is now being told, Job said, "I think you have 1 in 100 chance in order to succeed with this." But he went to the lab and he looked at the anatomy, and he had a colleague who was a hand surgeon who was using the palmaris longus tendon from the forearm, which we know to be the tendon we use all the time. And he was doing surgery to rebuild tendons and other types of conditions like polio and things that required tendon operations. And in their discussions, they came up with this concept of we can rebuild the ligament, we'll use the tendon, we'll drill some holes. And they performed the surgery, and the surgery reconstructed the anatomy of the native UCL, which was all filled with calcium on Joe because of the years of injury and cortisone injections. And they were able to reconstruct it. And in an unfortunate, or maybe fortunate, the way you look at it, John had an ulnar nerve neuropraxia. That means his nerve was asleep after the surgery. So his nerve was not working, and they waited for the nerve to recover. He's not throwing. He's doing some level of rehab, but his nerve's not working. And they went back and did a second operation, and they did a ulnar nerve transposition. And then his nerve over many months came back, and then he started throwing. And he had the way John explained it, he would just take baseballs and throw it against a wall, nice and easy. And progressively, he would increase the intensity and number of throws. And he kept on throwing, and he designed his rehab, and he got through it. And of course, he got back and has more wins after the surgery, pitched until he was 46 years old, and had an amazing career. And the reason why I say the ulnar nerve neuropraxia may have been fortunate is because there was no protocol for UCL rehabilitation, which we are trying to fine-tune and continuously fine-tune today that ulnar nerve neuropraxia delayed what probably would have been throwing and rehab that was too aggressive and too quick, and may have compromised the surgery, and that would have set Tommy John surgery back maybe a decade. And in fact, Frank Jobe did not do another operation of Tommy John surgery until Tommy John himself was recovered. And once he knew that the operation worked, he was ready to give it and offer it to other players, which is another expression of him being the doctor, the scientist, the person who had great integrity. He wasn't just going to keep trying operations on people until he had the information that said he knew how to do it.
That's amazing that you bring up so many of those points throughout the process, and especially the fact that, you know, Dr. Jobe didn't go into the second procedure until the first one was returned, whereas I'm sure you've done multiple UCL reconstructions on the same day, let alone in the same week. So that it goes to show you how things have changed over the last 50 years with this procedure. And to that point, what do you feel as someone that performs this operation and had a mentor that created the operation? What do you feel is the significance of this surgery and this risk-taking by both Dr. Jobe and Tommy John 50 years ago to the game of baseball?
It's hard to express that in words, Corey. We take it for granted. Players, media, fans, somebody has some elbow complaints. It's just a matter of getting the surgery and going through the recovery, and we tend to take it for granted. And I'll dive into that a little deeper with you about what the emotional impact is for some players and what the physical endurance you need to get through a year long of recovery, of working out every day. But to say that baseball is America's pastime and the most valuable player on the team arguably is the pitcher, and the contest between pitcher and hitter is such a fascinating part of American sports. Without a pitcher being able to throw, this game wouldn't be what it is. And the pitchers that we have come to know and honor for their, ability to make the game exciting, they're doing it because of an operation that Dr. Jobe invented, and that was at the direction of Tommy John, who would not settle for giving up a baseball career. So it's hard to put that into words, and in a thankful way, the surgery has now been scaled because a number of surgeons now can perform it. Say 10, 20 years ago, there was only a handful of surgeons who were, technically capable of achieving results in these high-level athletes who throw, when Jobe was doing it, 95 miles an hour. And when I first started, 95 miles an hour was the goal. Now the goal is 100 or 101, 102. That requires an amazing operative technical execution of the procedure, and also the rehab is also incredibly important. And we're seeing all kinds of injuries that are going along with the Tommy John, and that is the bone spurs, the ulnar nerve, flexor tendons are getting injured, things like that are going along with the Tommy John. That also, it's not just a package deal where you just get the same operation. There's a lot of considerations that go into some of the additional procedures that go into it. So I'm glad that you're bringing it up, because anybody who thinks that Tommy John surgery is just a commodity that you can just walk into a hospital and get it done, that's a mistake. This is a very technical operation that's done by people who have trained and who have a very special relationship with baseball. And the cool and amazing thing is we learn the surgical side from the players themselves and the athletic trainers on what we should be doing to get better at this. Because the athletic training staff has such a close relationship with the players. They know when players say, hey, I changed my grip on my changeup because I had a little tell, because my slot was a little different on my changeup. So I changed my grip, I got my arm in a better slot, and then all of a sudden I just started to develop elbow pain, and now I have symptoms. I don't get that from the players the same way that the trainers do, and they explain it to
Right.
us. And all of a sudden, we're working together to figure this out.
No, and I appreciate you saying that, both as being an athletic trainer, but also I don't think we can amplify this enough, that this procedure is not, a couple stitches and we're good to go. This is a highly technical procedure, a highly technical return. And it just goes to show the skill of surgeons like you, and I'll say skills of athletic trainers like myself to get these athletes back. And now I'm going to put you on the spot here and make you look into your crystal ball and tell me, where do you see this procedure going in the next 50 years? Obviously, we've gone from Dr. Job doing his first one and then waiting for that to come back until the second one, and now we're doing multiples per day all across the country with different surgeons and returning them at different levels. So where do you see the next advances in the procedure, and where do you see this landing? As you said, that the goal now is not just to come back and pitch, but it's to come back and pitch at 100, 101, 102 miles an hour with these big sweepers, sliders, and these hard changeups and all these things that with velocity being king. So where do you see the procedure really going in the next 50 years?
I'm worried about it, Corey. So thanks, and I'll tell you why. You mentioned it already. Velocity, high-intensity throwing is something that we can't keep up with from an injury perspective. And there's so much emphasis on hard throwing. It used to be year-round baseball was the issue, and that players would not take a break. Now it's the hunt for velocity with velocity enhancement programs during games, high-intensity throwing with every throw. There's no easy pitch anymore, as you already said. These breaking pitches and the off-speed pitches are being thrown with incredible intensity. And with the metrics that we have available instantly to players, they're analyzing not just velocity, spin rate, ball movement, and they're optimizing their pitching in such a way. And there's so much incentive to be the best pitcher you can be that the stress on the elbow can't keep up with it. So what does the future hold for us? It's going to be impossible to prevent this injury. And as the surgery gets better, and we are getting better, and I can touch on that, the original Tommy John surgery was a palmaris longus that was passed through some drill holes. Now we do procedures with Tommy John surgery with the drill holes in the graft, but we also can augment it with special materials to protect the ligament. And we call that the internal brace. That's how it's referred to. So in the evolution of Tommy John, we've modified some of the tunnels to make them a little bit more reproducible, a little less technically challenging, make sure the healing is optimized. But in the last 5 to 10 years, now we're making the construct stronger. And that makes rehab a little bit faster, and it can make the rehab less problematic with any setbacks. What I think is going to happen is as the surgery gets more reproducible and more people need the operation, we're starting to operate on patients earlier with less injury. And what I mean by that is early on, if you had a partial tear, you would always try non-operative treatment. It was only a full thickness tear, and sometimes a full thickness tear, you would try non-operative treatment. Now, players with the smallest injuries are going forward with surgery because the surgery is predictable, which is great. As we move forward and more people are getting exposed to higher levels of injury, there may come a time, and I hope it doesn't happen, but there may come a time, so I don't want to say it's predictive, but if we're going to prevent this injury, it may be that we're taking care of players at the first early warning signs of having a ligament issue and protecting their ligaments with things like internal braces and biologic injections to make their ligament heal when they're in the, say, off season at the end of the season, to maintain the health status of their ligament before they need to go forward with the Tommy John. So if you can picture this, if you in the off season had a 20-minute operation where you had an internal brace put in, and that could protect your ligament for the next 5 or 10 years, and you could be recovered during the off season, that sounds like something that a lot of people would want to do.
Sure.
And I'm not advocating it. I'm not saying ethically that's the right thing to do, that we put devices in people just to make them stronger so they can throw harder. But I think we're all having a hard time trying to contemplate the future when we know velocity is going to go up. The intensity of throwing with every pitch is going to be at max effort. And so we're going to see more and more injuries. And you know this as well as I do. I did this week, we're talking on a Thursday afternoon, within a 36-hour period, Tuesday and then Wednesday morning yesterday, I did 12 elbow surgeries that were Tommy John, and I did a total of 20 surgeries, and another several were elbow procedures for ulnar nerve and elbow arthroscopy. So that's in 1 week, and several of those players were professional athletes. Many were high schoolers, and many were college athletes. So the high school kids are getting these injuries, and because they have opportunities to get an education, go to college, have scholarships available to them, they want to do everything they can. So they have a incentive to throw hard as well and compete and get to the next level. And that next level is often college. And many are going to go on beyond college with a dream or an aspiration to, and they want to do everything they can to achieve that dream.
Well, and that's very sombering information to kind of throw out to all of our listeners. And obviously, when you're face to face with these athletes, whether they be high school athletes or professional athletes, there's a bit of wisdom and a bit of advice that you have to give them about the procedure, about the recovery. So, looking back at your time that you spent with Dr. Job, what lessons did he teach you that you utilize still today, and what information do you pass on to the physicians that are learning from you and coming up through the ranks?
Well, I'm going to start with this, and because I believe in it, and I touched on it before, Corey. There's 3 relationships that are extremely important in my life. One is with my wife. The other is with my kids, and the other is with athletic training staff. And I spend more time with the athletic training staff with the New York Yankees and also with some of the universities that I help with than at times than I do with my family. And we grind together. We celebrate when players get healthy, and we also share frustrations when players are getting hurt. If there's avoidable things that we can learn from, we work together. And getting back to Dr. Job, he had an amazing concept of working closely with athletic trainers and biomechanics experts. He set up the first biomechanics lab. And my time with him made me understand that taking care of baseball athletes requires a team approach. And compared to other athletes, the baseball player benefits from a team of multidisciplines. Those disciplines include, a physician, a surgeon, a non-operative specialist, radiology experts. Those are all people on the medical side, athletic trainers, physical therapists, nutritionists, sleep experts, and so the list goes on, strength and conditioning. And when we're working together for the benefit of the athlete, that's when we can feel like we're doing our best. And Dr. Job created that atmosphere, and he shared that with me personally. And it's something that I think about a lot as my career continues to continue, about making sure that we have the full complement of people, and not just for the professional athlete. We want to do it for the college and the high school athlete. And so sports science is a growing field that is taking off right now in ways that the future is going to be very interesting to see. And Dr. Job really started that. The second is he's extremely academic. Dr. Job would speak and go to meetings and teach other people and share his findings. The reason why the name Tommy John surgery got coined is because at meetings, he would speak about the ulnar collateral ligament reconstruction of the elbow with ipsilateral palmaris longus graft. That's a long way to describe a surgery if you're going to talk about it, repeatedly refer to it during a presentation. So he just started saying it's the surgery I did on Tommy John. And then he just started calling it the Tommy John surgery, and that's how it got its name. But he was an academic, and that is, he studied his first group of Tommy John patients, and then he published it in the medical journals and JBJS. And then he continued to do research, EMG, nerve conduction, or EMG studies on throwing biomechanics, etc. And he shared that with the world in a way that allows us to all get better. And so at my institution at Columbia, I try to model that behavior, and that is, let's do research and let's educate. He was a teacher of fellows. He taught fellows, many of whom stayed and joined his group, and others who have gone out into practice. And many of them are head team physicians or working in baseball organizations, and they're his disciples. And me being one of them, I am so honored to have this pedigree of having been taught by Dr. Jobe, and now my responsibility is to also teach the next generation. So we have a fellowship program at Columbia, for example, and that would have never have happened if Dr. Jobe and Dr. Kurland didn't set up this extra special training that is so important for sports medicine. And I think I could go on with how he's impacted myself personally. I also want to say that I am one of many fellows that he's impacted, and not just fellows that are surgeons, but people who are involved in sports medicine in so many ways. And I'll tell you an interesting story of how he got involved with the Yankees, or almost got involved. I was asked by Dr. Jobe to meet with him. He was going to come to New York, and he wanted to get together and have dinner. And of course, this was years after I'd been into practice and been taking care of the Yankees for a number of years. And because he was going to be in New York and wanted to have dinner with me, I said, why don't we get a group of fellows that he trained together? And some of the people I asked other fellows, and before you know it, we had fellows coming from all around the East Coast to come to a dinner. I had to find a venue. I got a big spot. We got a big room, and it was going to be a very special evening. The day of the dinner, we were in the middle of signing a very complicated health history, expensive player. This player got about 6 MRI scans, and throughout the day, I've been talking to the front office of the Yankees about his health risk, and they were trying to come to terms with, is he worth the risk or not? And these discussions were going on late into the evening, and now I'm running late for the Jobe dinner. And finally, the Yankees made a decision. They said they were going to sign the player. And I said, that's great news. I'm going to jump off the phone. I'm running to a dinner I set up for Dr. Frank Jobe. And I heard a pause on the other end, and the president of the organization said, hold on, you're meeting with Dr. Jobe tonight? And I said, yes. And he said, can you bring the MRI films and show it to him and have him review it?
Oh, that's outstanding. That is outstanding. Only in professional baseball does that happen, it seems like.
Yeah, he was years and years retired at that point, but of course his respect permeates all of baseball, and of course baseball organizations outside of just the standard people in the medical field. And people know my relationship with Dr. Jobe. I had a friend who was at Cooperstown and visiting with his son, and he took a picture of Dr. Jobe's instruments that sit in a cabinet, and those instruments were passing devices for sutures to get through the tunnel so then he can thread the graft through the tunnels. And it sits in Cooperstown, and that's pretty special.
Thanks for listening to Inside Athletic Training's first installment of Tales of the Tape, the Tommy John series. Make sure to tune in next week for episode 2 with Dr. Chris Ahmad.